Hello again, everyone. So today we're actually going to be talking about a different drug in my thesis presentation. And so if you guys are new here, please join the Discord down below and subscribe if you'd like to learn more about psychology, psychedelics, and mental health treatment or other related things, right? So today we're going to be talking about, as it says right here, MDMA therapy for PTSD, and this is an extremely effective treatment option for those with less treatable PTSD. My whole thesis was really kind of focused on less treatable mental illnesses, so less treatable depression, which is known as treatment-resistant depression, or major depressive disorder is often also lumped into that kind of category. And so for PTSD, there's a couple types. There's complex PTSD, but I'm not sure if that means that it's necessarily less treatable. I think that's kind of what that means, but just in general, we're looking at less treatable PTSD. So MDMA treats severe PTSD, right? And so what I like to look at here is like to provide some kind of visual. And so treating PTSD with MDMA-assisted therapy. And so these are phase 3 trial results that were published. And the researcher is Mitchell, and this was a 2021 study. So phase 3 basically means we're in the latter stage of research. And so MDMA is actually I think it's pretty close to being either legalized or it already is legalized for PTSD treatment. It's extremely effective, and as you can see here, this big orange pie chart is the big dark orange MDMA assisted therapy. The counterpart on the right here is 32%. So this is lost PTSD diagnosis. You can see that people with MDMA assisted therapy, 67% lost their diagnosis of PTSD. That's very remarkable, right? Whereas people with just therapy and a placebo, meaning they had no MDMA, only 32% lost their diagnosis. And 21% here on this side had a clinically meaningful response. And on this side, 30%. So you can see that even just therapy is pretty effective, but there's still this 38% of people that have no response. And here at MDMA-assisted therapy, there's 12% of people. So it's pretty good. The big difference here is that this is leading to a loss of PTSD diagnosis, which is remarkable, right? And so this is just a visual to kind of get you guys interested, at least. And so MDMA treats severe PTSD. PTSD is a very common disorder that has a few root causes. And so usually when you think of PTSD, you think of trauma, childhood trauma, veteran or army trauma, right? And the wars, stuff like that is going to lead often to PTSD. But PTSD can also be caused by a variety of other things that specifically stem from some sort of traumatic event, especially in childhood, or something just really jarring to one's person, and that's going to lead to PTSD. And so the thing about PTSD is that there's not, at least until now, there wasn't many super effective treatment options. We can give them SSRIs, but there's only a couple SSRIs that are frequently used and are deemed effective to treat SSRIs, and that's what it says here. Similar to treatment-resistant depression, some forms of PTSD do not respond well to SSRIs, and only specific SSRIs are prescribed for PTSD. So basically what this means is, the main treatment for PTSD in the past is going to be SSRIs, and if those 2 or 3 SSRIs don't work for the person with PTSD, they're pretty much not entirely out of luck, but they're basically out of luck, right? And there's only a few other treatment options they had, but now we have MDMA. So MDMA has been shown to lead to remission in many PTSD patients. Therapy is combined with MDMA as well. So if you guys saw my last video about psilocybin, if you haven't, go watch it. It's very interesting. They also combine therapy with that drug. And so for pretty much all of these drugs, what we're finding is that the most effective way to treat people with mental illness, and especially severe or chronic mental illness, is to not just give them a drug and say, here, take this home, have this, right? And then come back in a month or whatever. Not like we have done with SSRIs. That does work to some extent, as we can see here in this blue orb. This is just therapy. So that's not quite it. But what we really see is that combining the drug with therapy simultaneously is far more effective than just giving someone a drug and being like, here, take this. Because it's like someone's giving you, it's like you have a guide, like basically training you how to heal your brain, right? Throughout the process of the experience. And that seems to be why it's so remarkably effective. So how does MDMA work? Sorry, I'm blocking this. How does MDMA work? PTSD symptoms often include intense fear and anxiety. And so it's kind of my theory or my understanding that the reason MDMA is so effective is because it produces opposite effects that counter that of PTSD. And also, this is what it would look like for someone to go through an MDMA experience, or also this looks similar to ketamine therapy, which I'll probably go over in another video very soon. And so basically what they're doing is they're blocking out sense modalities. You have like probably some doctors or medical professionals here that are kind of talking them through this. And, and so these experiences can also often be very intense because you're delving deep into past trauma, which can be also very healing. So yeah, but MDMA produces opposite effects such as anxiety suppression, empathy, and affection. So fear or anxiety is obviously opposite to anxiety suppression. Fear is somewhat opposite to empathy and affection. So this is why I think that MDMA is so effective, because it's basically producing effects that are much stronger than the effects of PTSD, that basically counter and just completely counteract it, and in many cases completely put the patient into remission, which is very remarkable, right? So these MDMA is also much quicker than SSRIs in just a few hours. This is also the case with psilocybin, and then ketamine is even faster with just 45 minutes and the experience is over. So, but that is also ingested within the veins, so it's much faster acting. And so for MDMA, 75 to 125 milligrams is used in active doses across multiple studies, and many studies have actually found that 75 milligrams is going to be the preferred dose, I believe, just because that's a more moderate dose, and that's what they seem to find, which is interesting to think about anyway. So treatment reduces PTSD for many months, and this does vary, so depending on a lot of different factors, primarily how intense is the person's PTSD, how complex, how untreatable is it. And the second question, or the second factor that is going to determine how long this treatment lasts is how well does the person respond to MDMA? How well does their body take this drug? How do they mentally react to it? Stuff like that, right? But also it might not even have much of an effect at all for certain people, which is probably rare because MDMA is a rather strong drug. But yeah, so now we're going to be talking briefly about the limitations. This is just another graph showing basically what we showed in the last slide. It's basically the same thing as this, just in like bar graph format. So primary limitations of MDMA. MDMA is known to cause neurotoxicity in humans after repeated use, and so basically what this means is this is not particularly worrisome to those that are using this for PTSD, primarily because most of the information I found on neurotoxicity for MDMA was related to those that use it recreationally, but also repeatedly, right? So not just someone taking it every 6 months for PTSD. That's not recreational or repeated, really. So, but we might have some worries if we're trying to prescribe this to someone with PTSD like every month. But the data does not suggest we need to do that. So studies suggest the effectiveness of only one MDMA treatment can last for many months. So again, right, if it's lasting for many months, I remember reading 6 months to even a year, and they're still experiencing benefits from that experience, from the MDMA therapy session. And so what this means is we don't need to give it to them repeatedly or a bunch. So the risk of neurotoxicity is there, but it's not really super prevalent as long as we obviously the medical professionals know what they're doing and they don't prescribe it. They don't allow them to have it super often. And so also opioids are an extreme example of this because we prescribe opioids. If you guys did not know that, we prescribe opioids, we prescribe fentanyl medically, which might sound crazy, but we do, and that's a big reason why the opioid epidemic actually started. But whenever we use these things responsibly, whenever we don't allow people to take opioids home, like a big bottle of them home to use and abuse, right? These drugs can be really, really, really effective to treat different mental illnesses, and that's really what I think we'll see with all these different drugs. And so there's minimal risk of neurotoxicity can outweigh severe PTSD, right? So if someone has life debilitating chronic PTSD that is, they've tried to treat it and nothing's working, and it's really just like holding them back and they can't really live their fullest life at all. Is this minimal risk of neurotoxicity really going to be the end of the world for them? Probably not. So lastly, long-term effects not documented in depth. Of course, this is the case with pretty much all of these drugs. There's not a whole lot of long-term effects or long-term effects that have been documented. So we really need to understand that, these are strong drugs. These are drugs that alter your consciousness, that alter, temporarily alter the brain. And so there could be some long-term repercussions for that, even for minimal use. Is there actually? I mean, I can't say for sure, right? And that's just really going to have to be seen in the future. This is the same with psilocybin, MDMA, ketamine, and yeah, guys, that's pretty much this whole section here. Hopefully you enjoyed. You can see next we're going to be talking about ketamine. If you guys are interested in that, leave a comment down below. If you guys have any video ideas, let me know down below as well. Join my Discord. Thanks for watching, guys, and I'll see you guys in the next one.